Okay, now the topic you have chosen is liposuction and tummy tuck. Agreed? It's one of the most commonly performed procedure. I am Dr. M N Kumaresan, plastic surgeon in Apollo Hospital for more than 20 years. And who are the patients who can come for this? Male or female, whoever wants to have a normal abdomen with proper contour and shape can opt for this. There are no specific contraindications. Anybody can get this procedure provided they are fit for anesthesia. That is the main reason. If they have any comorbid conditions, yes, we have now so many specialties to counter that, and whoever is willing to have, 90% of the patients can go ahead with the procedure. There are no no's for this procedure unless otherwise medically they are not fit for anesthesia. Yeah. So who are the patients who commonly come for this procedure? Men with obesity, a huge stomach, a pot belly. For various reasons they develop pot belly. We will not go into the reasons in detail. Whoever has got a pot belly or a big abdomen can choose to have this. The second common people who wants to have six-pack abdomen, that is a well-defined lines in the abdomen, what we call it as six-packs, yeah, they can come for it. Women, mostly women after 2 or 3 pregnancies or whatever reasons, if they have a pot belly or they have a sagging belly, abdomen, they can opt for this surgical procedure. Now, we will go into steps of tummy tuck and liposuction in detail. Okay, first, in tummy tuck, what we do is we make an incision below the bikini line. So the scar is totally hidden under the bikini line. Yep. And we raise the flap up to the xiphisternum. It's an anatomical point, and we loop the umbilicus for new placement. The umbilicus has to be rightly placed. Most of these people who come for this procedure have the umbilicus lower, in the lower position than in the normal position. So we recenter the umbilical position. So as we raise the flap, the whole panniculus or the abdominal flap is raised. We suck the fat to contour the abdominal flap, so that when we re-drape the skin, it contours very well as what the patient wants, with what definition they want. All these things we can discuss with patients in detail before surgery, so they will understand the procedure and they can come for it, and we can tune the procedure to the requirement and need. Okay? Now, as we raise the flap and we do liposuction, whatever fat we suck out is permanent. All the excess skin and subcutaneous tissue is excised, and the flap is re-draped and sutured under the bikini line, and the umbilicus is placed in the new correct position, where umbilicus should be like for a virgin abdomen. So this is what the repositioning of umbilicus is all about. After we complete the surgery, so normally after 10 days, we remove the sutures and patients can get back to work after 15 days. The things they have to avoid or use it, they cannot weight lift for 3 months from below upwards. Number 2, they have to wear some pressure garments for 3 months for better contour and better skin tightening. This is what commonly we expect the patients to do. Okay. Now we shall go for the recovery period. Say today morning we get the surgery done. Okay. Post-operatively, normally we tell the patients to take rest for 24 hours. We put them on some suction drain and we remove the drain after 24 to 48 hours. But the very next day we make the patient walk with support, and usually the 3rd or 4th day the patients get discharged. They can walk on forward bending for 10 days till they get the suture removal done. After the sutures are removed, we normally put the patients on some abdominal garments, or we call it as binders, for better contour and skin tightening. And usually patients are not allowed to lift weight for 3 months because it's an abdominoplasty and your waistline surgery. So we are not allowed to weight lift for 3 months or even gym for at least 45 days. We prefer not to go to the gym. and use heavy weights there. This is the normal recovery protocol for patients who undergo tummy tuck with abdominoplasty. One little thing, and they have to, if they want to fly, want to use aeroplane, or they have to fly somewhere, they need to wait for 45 days after surgery. One of the commonest myths post tummy tuck and liposuction, the patients usually ask, will I lose weight? Which is, the answer is no. What we remove is around 5 to 6 kilos only. When patients have morbid obesity or a lot of obesity in other areas, this is not a procedure for weight loss. This is a procedure to contour your abdomen by a surgical procedure. The weight loss and other things can happen with diet and exercise for an overall benefit. That's a fact. Another common question we come across is, which is a better procedure, liposuction or tummy tuck? Actually, we combine both. Each will complement the other. Of course, liposuction can be done alone, abdominoplasty can be done alone, but the conditions are very, very rare where we just do separate procedures. Yes, patients who don't want big surgeries like abdominoplasty, they just want to get rid of fat in localized areas. Yes, we do isolated liposuction. This is what we normally do, but normally both are combined and they complement each other for better contour, skin tightening and nice waistline.